So now we move on with the documents for the OSCE 2021. Probably most of you are excited to hear this. So this is the first document. So whatever the scenario is, you will be seeing this document. So it's the candidate briefing. It contains the scenario. Let me read how it would look like on the examination. So you are a registered adult nurse working in Whitley Ward. Please conduct a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual care needs. As part of your assessment, please complete an 8-way assessment. So that is your airway breathing, circulation, disability, exposure. Intake and record the patient's vital signs, the blood pressure, temperature, pulse rate, oxygen saturation, respiratory rate, and calculate the national early warning score. Depending on the patient's circumstances and condition, you may wish to focus on some areas of assessment in more depth than the others. Next is, please note that there is no need to remove the patient's clothing to assess exposure. We will talk about this later. And all the equipment has been checked, calibrated, and is clean. So they put this information in this document now. Why? Because on the old examination, candidates tend to ask whether the equipment has been cleaned, whether the equipment has been checked, calibrated, and it's clean. So on the examination, on the new examination, it's already provided. Even on the old examination, the assessor, before you start, the assessor will tell you that the equipment has been cleaned and calibrated. Okay? And you will be using a green pen to complete this document. And you have 20 minutes, of course, to perform your assessment station. Estimate is today and 7 o'clock. You don't need to write anything on this document. You will just be able to read the scenario or what the scenario is all about or what is the task you have to complete for this station. Any question for this document? No question. So next is, this is probably the this is the counterpart of the admission booklet for the new test of competence. Okay, so this one is easier to understand as compared to the other one. So let's break down the contents of this document. So you'll be seeing the patient's details. So that's the name, the date of birth, the address, and the GP. So presenting complaint, you will see the complaints of the patients here. Same as you can see on the screen, let's say complaint of shortness of breath and edematous ankle. Oxygen has been discontinued, breathing has improved after diuretics administration, chest tightness. So those are the complaints. Next is the past medical history. So heart attack, angina, congestive cardiac failure, diabetes, rheumatoid arthritis, and the patient is partially deaf. Social history, you can also see on this page. You can see the patient is widowed and lives alone. The patient smokes 2 cigarettes per day. The patient drinks occasionally, I think it's written there. Yeah, per day. And the neighbor help with food shopping. So that is your social history and the drug history. So, and then at the bottom is the allergy. So for the new test of competence, you will be seeing the allergy section bottom of this page. Yeah. And you will see the reaction, which is anaphylaxis. So how long should you need to read the document faster. Okay. Later, when we break down the criteria, you would know when to read the remainder of, to fully read this document. Because on the marking criteria, there is a part there wherein it talks about exposure. So you will have a time to read or reread this document. But later we will give some tips. So this one is pretty much straightforward as compared to the old test of competence. I hope you do agree with that, yeah? Because it's only this page, and sorry, I forgot to include how would like the second page would look like. So the second page is like a note section, and it contains like headers like physical, sexual, yeah, psychosocial. Those are the only things written at the back page. So next is, we will now discuss the assessment tool. So first is the National Early Warning Score. So I will not show you on how to complete this document because again, we don't have enough time. But I will only give you the, some tips on how to complete this document. So the National Early Warning Score, it's called the News 2. So you might be wondering why it's called News 2. It's called News 2 because it was revamped. Originally the news was launched in 2012, and then it was modified back in 2017, I think December around that time, and it's now news to that means it's the second version. So the National Early Warning Score, it's a tool that we use to identify patients who are at risk of deterioration. Okay, and this tool is the tool we use to record our observations or our vital signs. Okay, so the vital signs are, of course, the respiration, blood pressure, pulse, um, consciousness level, temperature, and you have to document your findings using a dot. Emmer can we also use numbers, of course. Okay. Previously on our candidates, we do teach them to write numbers, and that is fine. But again, on the example on the website, I think they put a dot. So if you want to just put the dot, that is fine. Okay, that is fine. So Emmer, question: where can I find these documents? So once your trust book your examination, you will be able to have access or gain access with your online learning platforms, such as if you're going to Oxford Brookes University, you'll be given the Moodle. In Northampton, in Ulster, you might have the Blackboard or the Nile. For the new test of competence, if you search for OSCE examination, it will lead you to the website of the NMC, and all the test materials are readily available. Okay, you can still access it for free. But compared to the old examination, you will only be able to find these documents once your exam is booked. Okay? Always remember when you're writing, completing this document, you have to write the date and the time. Again, the date, you can write the word today, or you can just write the day and the month. So in the UK, we follow the date first before the month and then the year. We know in the Philippines, we follow the month, the day, the year. Okay, so it's kind of different here. And the time, again, it's 24-hour time format. And yeah, do not use this. Use SPO scale 1 only when you're documenting your um, saturation. Okay, because if you are using the scale number 2, it will give you a different score. Okay, so that is one of the most important things you have to remember on the examination. I think there is no scenario wherein you will be required to use the SPO to scale 2. Because if you look closely, it says here, only use scale 2 under the supervision of a qualified clinician. Normally, we use the scale if the patient has COPD, because the oxygen requirement for them is lower. Okay, so on the examination, just disregard that table and only use SPO2 scale number 1. For the blood pressure, so I'm just putting the things that you have to remember here, okay? So for the blood pressure, remember this: when you're counting or when you're counting the score, you only need to count using the systolic. You are not counting the diastolic for the news. And monitoring frequency. So make sure to put your news total, the monitoring frequency, which I will show you in a bit, and the escalation of care, whether you're going to escalate it or not, and your initial. So, guys, for our nurses, so far in my entire experience in the OSCE, most of the fails for the examination is because of the news chart. Okay, probably whether you've calculated the new news wrongly, you put the wrong monitoring frequency, or you put the wrong escalation, or you forgot the initials. Those are the most common reason why candidates are failing this particular station assessment. So far, in my experience, we never had a candidate who failed because of wrong health education. We never had that kind of failure. We never had a failure because of the candidate failed to wash their hands properly. We never had that kind of feedback from the test center. So far, it's probably like 95% of the reason why our candidates are failing is because of wrong documentation. Okay, so they're referring to the news score or news chart. So please make sure to perfect your news chart whenever you're performing your assessment station. So the second page of the news chart is the escalation. So let's talk about this briefly. So you can see here 0, the hour, the minute, the minimum frequency of monitoring is 12 hours. If the total is 1 to 4, the minimum hour is 4 to 6 hours. If there is a 3 in a single parameter, the minimum monitoring is every hour. And if it's 5 and above, the minimum is 1 hour. And if it's 7 and above, it should be continuous. So um, things to remember here. If you can see, it says their minimum. Let's try and go to total score of 1 to 4. So that means can I do 3 hours or 2 hours or 1 hour on my observation on my frequency of monitoring? Of course, because it says on the guideline it's just the minimum. So you can make your observation frequent. So why is that? Because if you see the clinical response on 1 to 4, inform the registered nurse who must assess the patient. Remember, on the examination, you are the nurse. And it says here, registered nurse decides whether to increase or decrease the frequency of monitoring. Always remember that. So if you see here, minimum of 36 hours, you can also do 3 hours, 2 hours, 1 hour, depending on your assessment. Okay, so which leads me to 3 in a single parameter. There might be a situation wherein the patient will be scoring 3. Okay, if you go back to 1 to 4, 3 is part of that. But let's try to think of like a scenario wherein the patient scored 3 because the respiration is high. If you come to think of it, are you going to wait for another 4 hours to recheck the patient? Of course not, because 4 hours is too long. If your patient is experiencing shortness of breath, of course, you have to recheck the patient probably like after 30 minutes or after 30 or 1 hour, depending on the patient's clinical condition. Okay, so always remember that. And for number 5, it says here minimum of an hourly, and make sure to inform a specialist team. So in the UK, we have what we call the outreach. Okay, outreach is a team composed of nurses with advanced skills. Okay, and they could give you some advice or they could help you in terms of managing your patient. And use your critical judgment. Okay, you have to use your critical judgment when you're doing assessment, and make sure you know when to escalate. You have to use your critical judgment. So based on your assessment, are you going to escalate to the doctor or not? Okay. So are you able to manage this patient on your own, or you need some advice or some help from other people? Okay. So that is your news in a nutshell. Do you have any question before we proceed? No question. Well done. Next. So the TPR. So far, this is not part of the new test of competence. It's just for the old OSCE. Okay, this one is for the old OSCE. This one is relatively easier as compared to the new start because it's the information. So you only need to put the year, the date, the month, the time, um, the pulse, the temperature, the blood pressure. The only thing that is missing on this document is the saturation. Okay, on this document, saturation is not being asked, the oxygen saturation. Okay, that is the only thing missing on this document. And you have to put your initial and respiratory rate. So if you're going to see this document on your examination, that means the scenario is in the community. Okay, TPR stands for temperature, pulse, and respiration. So the third document that you might be seeing on your examination, this one applies for the old and new examination, the Glasgow COMA scale. So similar with news, you will be documenting using dots, and pen torch. So someone asked the pen torch, so do you need to bring the pen torch on the examination? No, the test center will provide it. Okay. So later, once we do the marking criteria, I will be discussing what are the assessment that you will be performing if you're going to come across with the scenario which deals with GCS. Okay. So if you're doing the GCS, the only probably hurdle that you have to overcome is you have to perform the observation, the regular observation, which are the regular ones, like the temperature, pulse, blood pressure, what else? Respiration, the pulse, plus the GCS. That's why if you're getting this scenario on the examination, it's a bit longer, okay? Because you will be performing neuro-obs and the regular observations within 20-minute time, okay? Within the 20-minute time. So later we will be discussing what are What are those? Okay, what are those? And think about safety for this scenario. The scenario which this tool applies is the subdural hematoma. Okay, subdural hematoma. Definitely, you will not see this on a patient with asthma. You will not see this document on a patient with ectopic pregnancy. Okay, so this document only applies for scenario which talks about or deals with consciousness. Okay, so let's focus on the must first. So there are 5 steps. Step 1 is the BMI. So probably this is the same question you might be asking, do we need to calculate the BMI? The answer is, this document is pre-filled on the examination. This document is pre-populated. That means there are answers already. Okay, so if you go to step 1 BMI, it's already circled. Okay, so remember that, because it's impossible for you to calculate everything on the examination, because again, you for the old examination you only have 50 minutes, and for the new test competence you will be given only 20 minutes for this examination. So this document is pre-filled. Later I will tell you what is the only aspect of this document you have to accomplish. Step number 2 is, do we all know how to compute BMI? So that is your weight in kilograms divided by height in meters squared. So that is the formula for the BMI. Again, you don't have to calculate it. So if you can see the scoring system, you have 0, 1, and 2. 0 represented by green, 1 represented by yellow or amber, and then red is represented by, 2 is represented by red. So that is that. 2 is the highest possible score. So the second step is the percentage weight loss. So again, you don't have to compute for the percentage. On this examination, it's already been completed. Okay? So you only need to total the score. And number 3 is acute disease effect score. So this one, it asks, the only score is 2. Okay? So the question is, if the person is acutely ill and there has been likely to be no nutritional intake for more than 5 days. Okay? So if you come to think of it, if the patient is in the community, most likely they are not acutely ill. Okay? So if the patient, let's say the patient said, oh nurse, I have poor appetite, but the patient is still eating, probably like small portions of the food, or like drinking very little, but they're still eating. Definitely the patient will not score 2. Okay? Most likely the score is 0. So if you can see on this section, the only answer or the score is 2. So if the patient doesn't meet the criteria of 2, it's automatically 0. Okay? It's automatically 0. Again, the patient is in the community. Most likely the patient is not acutely ill. Okay? So that is that. That's why part of your conversation with the must is to check if the patient has been eating or not in the last 5 days. Okay? So what is the only thing you have to do on this scenario? You have to put the score, the total score. Okay? So the total score. And if you can see at the bottom of the screen, you have to put the date, the time, and your signature. Okay? So signature, can your actual signature, that's fine, or you can put your initials. Okay? Initials will be counted as signature. So what will be the conversation with regards to this? So the must is actually easy in terms of the document, because you only need to total the score and you have to sign it. But the most important thing for the must is the conversation, is the health education for the for the must. So make sure as part, so step 5, this is the last step, the management guidelines. So if you can see, if the score is 0, that is low risk. If the score is 1, that is medium risk. If it's 2 and above, that means the patient is high risk. Okay, the patient is high risk. So the boxes will tell you what to do. Okay, but the only thing is, in reality, because if you can see on, let's say, 2 and above, in the hospital, you can see monitor the must weekly. So that's fine. We normally that's what's happening in here in the UK. So we normally monitor the patient's must, the BMI, every week. But if you see here, care home monthly. So remember, on this scenario, you are in the community. So if you're going to write monthly on your care plans, that is fine. Or alternatively, you can say days. Let's say your patient is not eating. let's say the patient is already malnourished. Are you going to wait for another month to reevaluate the patient? Of course not. Okay. So better probably check the patient after probably 3 days, 5 days, or 7 days, because that's normally how the community nurses deal with these patients. They don't wait for another month to check the patient because probably after a month, the patient is already dead. Okay. So you have to use your critical judgment. So the only thing for the community scenario is you might be talking about days, okay, or weeks. As compared, if you remember the news, we are talking about hours because you're in the hospital, because nurses are in the hospital 24/7. But that is not the case in the community. Okay, if you're visiting the patient in, let's say, a residential home or in their own home, you will not be there 24/7 as a nurse. You only have like allocated days to visit the patient. So, Ariane, she's asking, do they provide a copy of step number 5? Yeah. Apart from this document, we will also be given the guidelines for the steps for must. There's another document showing this. Okay, this one. You have this document on the examination. Um, Josh, is it Joshua or Josh? Joshua, to be validated on the next visit or 5 days, for example. Um, So your question is to be evaluated on the next visit. The only problem is if you're going to say the next visit, when is the next visit happening? It can be the next visit could be this afternoon, isn't it? The next visit could be tomorrow. So probably you specify when the next visit is. Probably 5 days will be better. Okay? You can say 3 days, 5 days, or 7 days. Again, depending on your assessment. Okay? And you won't be penalized because of that. Because you're using your critical judgment. But then again, as part of your conversation, you tell the patient, why are you doing such actions? Why is this your care plan? So food diary, remember that if the patient is 2 and above, or if you like, you could educate the patient to commence food diary. Normally, we have a 3-day food diary. What does it? What is this for? So the patient could monitor, or you could monitor if the patient's food intake is improving or not. Normally, we give them like a 3-day food diary so they could record their intake in the next 3 days. Nutritional supplement. So ensure um, hydration. Remember, if you talk about nutrition, hydration is also part of that. You encourage the patient to drink, not booze but water. Okay. So next is also you can also teach the patient on about the risk of developing pressure ulcer. Remember, if you're skin and bones, you are most at risk of developing pressure ulcer. So we'll be discussing Braden on the next coming webinar. So remember that, okay? So, changing of position, and you have to emphasize the importance of adequate nutrition. Improve appetite. So improvement of appetite is kind of hard, but there are ways of doing it. Probably you could ask the patient, you could give the patient food menu. The patient could probably select what food they want to eat. Probably because you're giving them spicy food and they don't like spicy food. That's why they're not eating. So let the patient choose what food they prefer. Probably we can encourage social dining. Can be one of the interventions to increase appetite. Another one is probably could include family and friends. Do we agree that the food tastes better if you're eating with someone, with your family, with your friends? These can be your interventions or your health educations when you deal with this scenario. Small frequent feeding, and most especially to refer the patient to the dietitian. Okay, so that's the most important thing, to refer the patient to the dietitian. Most especially if their score is 2 and above. Okay, if it's 2 and above. Emmer, can you also refer the patient if the score is 1? Of course. If you think the patient needs it, you can do it, okay, on the examination. And in reality as well, if the patient scored 1, if you think the patient needs a referral to dietitian, you can do it. Yep. So that is our malnutrition in a nutshell.